The history of pellagra offers a striking example of how nutritional deficiencies can be misinterpreted as psychiatric disorders, with lasting consequences for how we view the relationship between diet and mental health. Pellagra, a condition caused by severe niacin deficiency, presents with the classic 3DS: dermatitis, diarrhea, and dementia. But what's often forgotten is that the dementia component can be so profound that it mimics major psychiatric illnesses. In the early 20th century, thousands of individuals suffering from pellagra were institutionalized, misdiagnosed as insane, when in reality they were experiencing neuropsychiatric symptoms caused by a lack of vitamin B3. This dark chapter in medical history still shadows our current thinking, subtly influencing how we perceive the connection between micronutrients and mental disorders. At its peak, pellagra was widespread in poor populations reliant on corn-based diets that were low in bioavailable niacin. It was especially prevalent in the American South, where economic hardship and limited dietary diversity led to outbreaks affecting entire communities. Physicians initially believed pellagra was caused by infection or poor hygiene, and when patients became confused, irritable, delusional, or depressed, often accompanied by tremors and personality changes, these symptoms were routinely classified as mental illness. It wasn't until Dr. Joseph Goldberger's groundbreaking work in the early 1900s that niacin deficiency was identified as the true cause, and it took decades more before this insight was fully accepted by the medical establishment. The fact that a simple vitamin deficiency could produce such severe cognitive and emotional disturbance was revolutionary and uncomfortable. It challenged prevailing beliefs about the origins of mental illness and suggested that at least some psychiatric symptoms might arise not from purely psychological or genetic causes, but from malnutrition. This idea, while validated in the case of pellagra, was not easily extended to broader psychiatric practice. Even today, nutrition is often treated as peripheral in mental health settings, and deficiencies in vitamins like B3 are rarely considered unless symptoms are extreme. Yet the legacy of pellagra should make us rethink that oversight. We now know that even mild niacin deficiency can impair brain function, contributing to symptoms like anxiety, brain fog, poor concentration, and low mood. These effects may not be dramatic enough to trigger a clinical diagnosis, but they can significantly affect quality of life and cognitive performance. Unfortunately, because niacin deficiency no longer presents in its classic form in most developed countries, the more subtle neurological symptoms tend to be ignored or misattributed to stress, aging, or purely psychological causes. What makes this even more troubling is the enduring compartmentalization of medicine. Mental health and nutrition are still too often treated as separate fields, despite decades of research showing how nutrients like niacin influence neurotransmitter synthesis, mitochondrial function, inflammation regulation, and even gene expression in the brain. The very fact that a vitamin deficiency once led to widespread institutionalization should have been a wake-up call to explore the broader role of nutrition in psychiatric disorders. Instead, the lesson of pellagra has been largely confined to historical footnotes. Even more paradoxically, niacin has shown therapeutic potential in modern psychiatric contexts. High-dose niacin has been studied for use in schizophrenia and other mood disorders, partly due to its vasodilatory effects and its support of NAD+ synthesis in the brain. While the scientific evidence is mixed and the dosing controversial, the very fact that niacin could influence mental state speaks to its centrality in brain health. Still, the mental health world remains cautious, perhaps too cautious, about drawing connections between micronutrient levels and psychiatric outcomes. This lingering reluctance may stem from the original misclassification of pellagra. Because the disease was once considered psychiatric and later demoted to a nutritional disorder, there's a subconscious stigma around linking vitamins to serious mental illness, as though doing so would trivialize the condition. But the truth is the opposite. Recognizing the biochemical underpinnings of brain dysfunction elevates our understanding, opening the door to more comprehensive and effective care. Ultimately, the story of pellagra is not just a cautionary tale from the past. It's a compelling argument for paying closer attention to micronutrient status in mental health today. Niacin deficiency, even in its subtler modern forms, may be quietly influencing mood, cognition, and behavior in ways that we too easily overlook. By restoring respect for vitamin B3, not only as a metabolic cofactor, but as a neuropsychiatric safeguard, we honor both the lessons of history and the future potential of nutritional medicine.